Hello, everybody. Today I am being joined by the Managing Director of Cyprus IVF Hospital, Nevzat. Welcome.
Thank you, Leslie. Good to have you here today.
And today we are going to be discussing genetics testing 101, explanations, what it means, whether people should do it, and also discussing gender testing. So if we start first of all with genetics testing on men, women for fertility, could you tell me a little bit more about the genetic tests offered for male and female fertility?
It's a good question. So lots of people, they find on the internet, we call it PGT. So that is pre-implementation genetic testing. We have basically, what does that mean? That we screen the embryos and the intended parents before the fertility treatments. Mainly in the infertility program, first of all, if there is any genetic problem that the intended parent is carrying, we apply the genetic testing via blood testing to the men and women. That is something completely different than the pre-implantation genetic testing that we apply to the embryos. Mm-hmm. So if the two people that have a problem with the genetic that they couldn't identify it before, we apply them the genetic testing, or if a person has lots of miscarriages or some problems that they lose the baby in a short while or a long term, there is a different kind of genetic screening that we are applying to the intended parents. But that is number one, part one. Part two, that genetic screening that we apply to the embryos, that's the most critical part and well-known actually part in the infertility world. The PGT, like pre-implementation genetic testing, divided in two main categories. Number one, we called it PGD, which is pre-implementation genetic diagnosis, and then PGS, which is pre-implementation genetic screening. So people need to know what's the main differences between these two. One is we don't know what's the problem or if any problem coming from the intended parent and inherited to the embryos. So we do a general screening, okay? And number two is the diagnosis. So we know where is the problem and we focus on that part and we check what's going on there. Yeah. So, but at the moment, if you go to any infertility clinic's website or hospital website, the general name called PGD. But right now, if you go a bit more in details, there's different type, PGTA, PGTS. These are the new names given to PGD and PGS. So one thing that I want to clarify, we used to call PGS, pre-implementation genetic screening. Now the new name is PGTA. We used to call PGD, pre-implementation genetic diagnosis. Now we call it PGTM. So which is a pre-implementation genetic testing for monogenetic, single gene.
So is it the names that have changed, or is the actual process different now?
No, just the names to make it more clear for the patients. Because it was so generic before, screening or diagnosis, but now we know that the diagnosis, which is, we used to be PGD, now is PGTM. It's a pre-implementation genetic testing for monogenic, which means single gene defects. So it's more clear right now. But unfortunately, the general medicine world, they still insisting to using the old names. Even us at the moment, we couldn't update our website content based on this new information because most of the patients, they're not aware of this.
I see.
So we want to do that, move ahead and be the leader in the industry and update our content effective 1st of June. But that will be a bit difficult for the patients initially, but that will be the right information by ESHRE. So.
And the the acronyms can be confusing, can't they? Because people start to think, well, do I need this testing done? It's going to cost X. Is it going to improve my chances? What is it actually screening for? So it's hard to know, isn't it, what's useful and what perhaps everybody doesn't need, depending on the situation.
Okay. Yeah. So just a quick information about that. People, they come to ask our patients, do I need to do like PGD? Let's say we call it PGD, the pre-implementation genetic diagnosis, or PGS. That is really depending on the circumstances of each patient. If you have a genetic disorder, either you or in your family tree, and it is known, and you have the documentation for that, yes, you need to do a genetic test for that single gene for sure, to avoid that in your next generations. So we apply the genetic test to the embryos to see if that embryo carries that specific gene, which will cause an issue later on when the child comes to this world. That's number one. Number two, if you, again, based on the patient, if we see, like, for example, if you're above 35, if your egg quality is not really good, if your sperm quality is not really good, we definitely recommend PGT-A, which we check the chromosomes and see if, let's say, the embryo is carrying Down syndrome and that kind of things, because that kind of chromosomal problems occurred when you have a low egg quality and low sperm quality. So the embryo quality is low and it carries lots of chromosome issues. So yeah, we recommend our patients about 35 if they want to do the, at least, because even for that test, this PGT-A, you can check 5 chromosome, 7 chromosome, 9 chromosome, or you can apply NGS, which we checked 24 chromosomes. So depending on each patient case, it really depends. That's why I don't really want to say something generic, because we apply personalized protocols for our patients. So that's why they shouldn't read on the internet with this generic information. And hey, I want to do that. I want to do this genetic test. Because we don't want to just charge them and get their money. We really want to perform the things that it really needs to be done for them.
In terms of genetic testing of gametes and embryos, what percentage of embryos pass the genetic testing?
So based on, again, the ESHRE, for example, the worldwide statistics, it's very clear. If you are between age 35 and 40, it's approximately 50% of the embryos are passing. If you're above 40, only 20% of the embryos are passing the genetic tests. But again, that is depending on which type of genetic test you're applying. Are you checking 5 chromosome only, 7 chromosome, 9 chromosome? It depends on which particular genetic test that you are going after. But if we check the general, which is provided by ESHRE, they say between 35 and 40, 50% is passing. Above 40, you can relate it with the quality of the eggs, because after age 40, the egg reserve started to decrease significantly, and also the quality. So therefore, the embryos formed from a bad quality of eggs and, of course, sperm, then the quality of embryos is not really good, and only 20% of the embryos in general pass the genetic test.
Thank you for that. Can eggs be tested for genetic disorders?
No, the only fertilized eggs can be tested. Or we can apply, for example, the single gene test to the woman via blood, but not from the eggs. No.
And genetic testing on embryos, what does that tell you?
Yeah. Again, depending on which genetic tests we are performing, but let's say in Africa region, for example, we have lots of patients coming from Africa, and most of the African countries, people, they carry sickle cell anemia. Okay, so when they come over here for an IVF, that's a very good option for them, because we can apply genetic test to embryos to see if they are carrying sickle cell anemia, for example. The other example can be, I'm just trying to find, I have some result what we are finding, for example, in front of me, when we apply the test. What else we are finding generally? Sickle cell anemia is number one, and number two, cystic fibrosis, for example. It's in front of me, for example. One of the tests that we are applying to find out that if the embryo is carrying the cystic fibrosis. Because we know that where they're coming from, we know that it's very general disease over there, and we don't want them to apply that. Or in some cases, for example, because of the age, let's say we have a patient comes at 41, they use their own sperm and their own egg, and we strongly recommend them to apply PGT-A to see if the embryo is carrying any problem with, or like chromosome 21, chromosome 18, chromosome 16, which are like, one of them is Down syndrome, for example. Because with a bad egg quality and sperm quality, that can happen at a significant rate. To avoid this kind of issues, we strongly recommend to apply, for example, PGT-A.
Makes sense. And what about embryo testing? Can it only be done on blastocysts?
That is completely depends. For example, if we apply PGT-A, which is the most main one, so we apply PGT-A, we check 5 chromosome. That's the lowest genetic package that we are offering. We create the embryo, and then we take the biopsy on day 3. And then we apply the genetic test, not on day 5. But for a single gene test, the embryologist that recommends that we need to take the biopsy on day 5 on the blastocytes. But normally, PGT-A, we take the biopsy on day 3.
Okay.
There's a rate there, sorry, just a quick information, that they checked if the embryos on day 3 reach certain level of cells, like 6 cells, 8 cells, and based on that, they decide to take the biopsy on day 3 and move forward.
Okay. And when patients come to you at Cyprus IVF Hospital, how do you determine which patients should have genetic screening done?
Again, that's why it's really important that patients provide you their medical history.
Yeah.
We have a system that we've gone through to their entire medical history, ask all the necessary questions, collect all the information from them, and then they have a kind of an AI algorithm that tells us, for this patient, based on this information provided, genetic testing is not needed, or it has genetic testing needed at least 5 chromosomes. If there is a like non-single gene issue, it has to be 100% applied. We call it PGS. With new name is PGTM. That we have to apply this single gene test on day 5 on the blastocytes and see if any of the embryos is carrying that. Like as an example for that is we call it BARAC. BR2AC. It's very common, for example, in UK, that a person might carry a gene which is causing the breast cancer, high risk of breast cancer. So, for example, if we know that there is such a problem in the gene of the patient, we 100% recommend that definitely we need to apply the PGTM. So we check. And related with the age, medical history, we strongly recommend our patients to perform them. Mm-hmm. But for the donation program, on the other side, like egg donation or embryo donation, we apply the genetic test to the donors anyway. So if a person become an egg donor for us, it has a clear history and all the genetic tests perform that person, and we don't need to really apply, for example, genetic tests to the embryos. because we already performed all the tests and gone through to our system. But with normal IVF, that's not the case because we don't know the patient case in details.
And do you find that patients feel as though it's going to be a more successful outcome if the embryos have been tested?
Most of the patients, they think that PGD, like the pre-genetic implementation screening, it's increased their chance, plus that I don't know why, but they think that definitely there will be something wrong with the embryos. And they really scared of like, oh, I don't want to have a baby with a like Down syndrome or something like that. But these things can happen with a natural cycle anyway. So, but when they have the chance to do that, they really want to do it. And, you know, we are okay with that, of course, to provide them these services. The only problem we used to have, if we go 5 years back, when you apply the genetic testing to embryos and not applying the fresh transfer, the success rate will go down between 3 to 10%.
Right. Okay, that's good to know.
Because you are touching to embryo and you are taking a biopsy inside from the embryo. But now with the new technology and the latest results that we also received from ESHRE, this amount decreased significantly between 1 to 3%. So there is pros and cons. So if a couple is young, healthy, there's no problem with any genetic disorder or something like that, but naturally they cannot have a child, so we just need to apply the IVF to them. We don't recommend the genetic testing because we don't want to touch the embryo and reduce the successful IVF cycle. That's something else. But the amount is right now, as I said, between 1 to 3%. But if the age is there and there is a medical history over there, definitely we want to know which embryo is healthy to increase the chance of the successful transfer, because if it's not healthy, it's not going to be successful anyway. Yeah. So there's two sides of it.
Mm-hmm. Thank you for clarifying. I'd like to ask you about gender testing, and I know that this is something that you offer at Cyprus IVF Hospital. Is it something that patients are interested in?
A lot. We call it gender selection program, but basically in North Cyprus, gender selection is allowed if we perform the normal genetic testing. Right. So if you come here and then I say, I want to apply the genetic testing, PGTA, to check 5 chromosome. When we apply that, we also receive the result if the embryo is X or XY, and we are allowed to share this information with the patient. With that case, patient can decide, oh, okay, so I have 5 embryos healthy, 3 they are boys and 2 girls. I want to transfer 1 girl, 1 boy. Or some of them, they said, oh, I want to have boys, so can we transfer the boy initially? And if it's successful, then I will have a boy. If not, second try, we can try with the boy again. If it's not working, then we can move to the girls. Yes, it's allowed in North Cyprus, and we apply that in our hospital. Okay. And so people are really keen to learn the gender, some of the people. So coming from, especially from Middle East and Eastern Europe, people are really keen to learn and move forward with the gender selection. Is
it expensive to do?
No, it costs that is included in the basic genetic package, which is we checked 5 chromosome, €2,000, which is quite affordable. With that, we checked chromosome 13, 18, 21, and X and Y. So that's €2,000 extra.
What do you think are the pros and cons of genetic testing and risks of gender selection?
As I said, some people, they just, without needing the genetic testing based on the medical history, they want to apply lots of genetic testing. And each time we touch the embryo, that reduces the success rate of the successful cycle. So that's a problem. Some people, that we definitely offer them to apply the genetic testing because of their age or their medical history. And then result comes up And then let's say we also know the gender, and they say, oh, I want boys, but there's only one healthy, and the other three, let's say healthy, is girls. And they said, oh, we don't want them, we just only want boy. For us, that's a bit harsh to receive such a feedback, especially if the patient hasn't got a child before, and if it's going to be the first child, and you are only focusing on the desired gender. As a hospital, the IVF hospital, we definitely don't recommend that, and we clearly tell that to our patients. Guys, the main goal is to
have a healthy baby.
Have a healthy baby. You shouldn't think about the gender, but with the result we receive it, and we need to share it.
Yeah, of course.
You know, so we have some cases that because the desired gender is not there, they didn't proceed with the other healthy non-desired gender for the transfer. That was for us shocking, for example. And of course, we respect everyone's decision, but our main goal is, first of all, to make them a parent, a family. Definitely. So that's my personal opinion, by the way. I respect everyone's decisions, but from my side, this is, I find a bit strange on that matter.
Well, with seeing our wonderful, large, trying to conceive community, you know, the resounding desire is to become a parent and to have a healthy baby to love. And so, yeah, exactly. That's just what people want. So I can see how that would be a challenging thing to have to discuss. And I'd love you to tell our readers or viewers a bit more about Cyprus IVF Hospital, because I know that you see patients from all over the world, don't you, who come internationally because treatment is obviously at a premium level. You have fantastic facilities and it's more affordable. And also you can treat patients who are, you know, in their 50s, for example, or later 40s. Could you tell us a bit more about that and the donor program?
Yeah, sure. So as a Cyprus IVF Hospital, we are the subsidiary of the Cyprus Central Hospital in North Cyprus, which is the first private hospital in North Cyprus, and which also obtained the ISO 9001 certification. So we are not a clinic like 100 square meter. We are under the roof of Cyprus Central Hospital, which is 10,000 square meter of hospital, and offering every kind of treatment options in every different field to our patient. That gives us a huge comfort. And of course, we can offer the high standard of facilities and services to our patient, because when our 95% of our patients, they're coming from abroad, mainly from US, Canada, Western Europe, Africa, Middle East, Nordics. And it's not easy to just they fly average 4 or 5 hours to reach our country. And when they come over here, we want to offer them every possible solution. So when they come over here, we don't want to send them back with their hands empty. Some people, they come here for a normal IVF, for example. But just a small note, because we can apply the IVF up to age 55. It's legal to apply IVF up to 55 in North Cyprus. So some people, they come, let's say, age 45, and they want to have a normal IVF, which we apply all the tests here for both male and female. And then let's say we find out that lady hasn't got any egg reserve, so it's not possible to move forward with a normal IVF. Okay, good. We have an egg donation program. We have various of egg donors in our egg bank, which we can offer them at least 2 to 3 options as per their profile. And then if they choose one, then we will move forward and apply them an egg donation program. Some cases we have a problem with the male infertility. He doesn't even know when he comes here. We checked, we did the test, and let's say there's a problem with the sperm. We immediately send it to our urologist. As I said, because we have a huge hospital, we have every kind of operations here. We can apply TESA to receive the sperm. If still the result is 0, then we can apply the sperm donation program, because we have a sperm donation program. We work with European Sperm Bank and Kairos International Sperm Bank in Europe, both of them. We receive the sperm directly from them. And then we can offer the sperm program. If the problem is with both, Then we have an embryo donation program. And based on their profile, we use fresh egg and sperm and create the embryos based on their profile and transfer them. Recently, we received lots of patients above 45, and they mainly come egg donation program or embryo donation program, because also in North Cyprus, we are not, you are not obliged to be married. So if you are a single lady, you can come here, or you're a couple but not married, you can come here and apply the IVF or any donation program.
Same-sex couples as
yes,
well?
We are LGBTQ plus friendly hospital. So we have lots of same-sex couple. We have lots of gay couple coming from Western Europe, US. We have lots of lesbian couples coming from also Western Europe, also from Asia recently, lots of lesbian couples. So we apply ROPA to them. And for the gay couple, either they bring their own surrogate mother, or we provide the surrogacy service here for them. So we apply every possible infertility program to solve the fertility program, to solve their infertility issues at our hospital. And the good thing is, as I said, that as a hospital, we perform everything here. They come, they meet with the team, they see the doctor, then they go downstairs for the blood test, then they go for mammography, they go for the HSG. If there's a problem, there's other 5 other gynecologists here. We can apply for the hysteroscopy or laparoscopy. Everything is here. So when they come here, we don't send our patients with their, oh, you have a problem, go back home, solve it and come back. No, everything handled under one roof, which is a 10,000 square meter of hospital.
Amazing. So anyone who is interested in speaking to Nevzat or their team, then please do follow the link, which is here, to get in touch, and they can help you with whatever kind of family building scenario you're looking at, which is incredible. And also Cyprus is obviously a very nice destination to go to whilst you're spending time there. I think one of the questions that we see a lot for people who are having treatment abroad, I had treatment abroad, is how much time do they need to spend in Cyprus so that they can do it around work schedules, for example?
Very good question, Eloise. We have 3 different options. They can find these 3 different options also on our YouTube channel, Cyprus IVF Hospital YouTube channel. We have a nice video which explains that. If you come for a full treatment from A to Z completely here, 100%, it will take up to 21 days. But most of the people, they're working and they're not able to spend 21 days in here in North Cyprus. So there's 2 other options. One, they come here only for a weekend, Saturday and Sunday. We meet with them. We do all the necessary checks here, all the blood tests here, check their results, review it with our doctor, and give their medicines and send them back home so they can start their protocol back home. So they don't need to find a doctor, do the test, get the medicines in their country. They come only for 2 days here. We do everything for them, and it's super cheap compared to, especially for the Western Europe here. And then provide them the medicines. They go back home, they start the protocol, and then next time they only come here for 10 days. So that's the option 2 that most of the patients, they strongly moving that path, that they come home a couple of days, do the test, get the medicines, go back, and they only come for here for 10 days. Or the other way around, you can also divide it this 21 days in 2. You come for 10 days, we do everything here, monitor, and then you go back home, and then you come here for transfer again. It really depends. For like the donation programs, the period is much shorter. You can stay 1 day coming here, go back home, and then come here only for transfer for a week. That's enough.
Wow, amazing, amazing.
Yeah. By the way, we support 6 different languages. So alongside with English, we support French, German, Arabic, Turkish, Farsi, and also recently we also support Russian. So and we're planning to add Italian as well very soon. So people who's coming abroad, they shouldn't be worried about any language barrier. Our team is here to support every kind of patients coming abroad.
And is the first consult free?
Yes.
Yes, so people should sign up for a free consult today. We're dropping the links here, as well as that YouTube video link explaining about the process and timing to do treatment abroad. So thank you so much, Nevzat, for your time today. It's been very insightful, and it's wonderful to be partnering with such a fantastic hospital and clinic in Cyprus.
Likewise. Thank you very much, Eloise.
Thank you. Bye-bye.
Yeah, bye-bye.